Mike, let's start where we normally do with the domestic and global epidemiology. The U.S. is seeing a 7-day average of at least 248,000 new COVID-19 cases and at least 3,200 deaths a day. The numbers just continue to climb in nearly every state, with some doing much worse than others. You said last week that you weren't sure what's going on. Has a week added any clarity?
Well, it has added some new information, but I'm still not sure I know what's going on. I look at the case numbers for this past week. If I take the cases reported in January 12th for Tuesday, the day most current before the podcast here, as you pointed out, there were almost 230,000 new cases reported. That's a 37% increase over the last 14-day moving average. In total, 22.9 million cases. If you look at the deaths, a staggering number, 4,406 deaths reported today, a 49% increase over the 14-day time period, giving us now 382,000 deaths. And the hospitalizations have hit an all-time high at 131,326, a 9% increase for 14 days, but clearly a very, very ominous trend in terms of our ability to provide health care. Just to put these numbers into perspective, and it's very important, we do two things. One is in each and every time I talk about these, I want to remind all of us, these are our loved ones. These are the people we have cared about. These are the people who have been our colleagues. These are the people who have meant something to us. And they're gone. They're gone. And to put this in comparison with other public health challenges, if you look at the numbers of estimated deaths for influenza for the 10-year period from 2010 to 2020 here in the United States, the CDC estimates that there have been between 12 and 61,000 deaths, likely somewhere in the middle of that, 12 to 61,000 deaths. We've already reported 382,682 deaths as of today for this past year. And we know that that number is going to continue to climb precipitously. When we look at the increases in cases by states, we saw something this past week we haven't seen before. If you take the 50 states and the District of Columbia, 51 different entities, cases are climbing in 50 locations, 49 states in the District of Columbia. The only place that they aren't climbing right now is Hawaii. We haven't seen that since the pandemic began. Large parts of California remain in a major lockdown. Other areas of the country are experiencing the same thing. We are now seeing what I would call a shifting baseline, a concept that was put forward by Randy Olson, the communication expert I just spoke about some years ago. The shifting baseline is now that we have gone from when 20,000 cases was really bad to 70,000 cases was really bad to 280,000 cases is really bad. And now we're actually hitting on a number of days 300,000 cases a day. Wouldn't it be something if we could go back to only 22,000 cases a day? You could say that may sound terrible. I realize those are still all individuals again, but boy, it sure would beat what's happening in the United States right now. I think that this is in part our pandemic fatigue. And as one of our listeners shared with me several weeks ago, we're probably experiencing pandemnesia, a pandemic amnesia that is here. We are starting to see the surge in a number of states associated with the Christmas holiday, New Year time period. I personally am aware of people right now who are in critical condition as a result of an exposure that occurred in their home on Christmas Day. All the things we talked about. And, for many of you who are on this podcast who did participate in those same events and fortunately have come out not having been infected, I hope that you don't ever get infected. But again, each time you do that, you take a chance. So I'm going to talk more about the issue of variants in a moment and what that might be doing. And I don't think at this point that the increase in cases is due necessarily to new, more infectious strains of the virus in our communities. It's us. It is us. We are not understanding that, in fact, this virus is still here. Now, when we heard news that a vaccine was coming, I think many of us felt, haha, I can coast to the end. We can't. We can't. 4,406 deaths reported today. Let me just restate that. Right now, this is the leading cause of death in the United States. And it's caused by a virus that we're breathing in because, unfortunately, far too many of us put ourselves in harm's way when we wouldn't have to. Now, there are a number of essential workers, people who just have to put themselves in harm's way. We can only hope that they have adequate respiratory protection. But far too many of us are putting ourselves in harm's way. So, Chris, my real sense of this is we're just seeing increases across the country, tied right now to the holiday season activity. In the Sun Belt states in particular, we're seeing this major increase in cases. And as we talk about the variants going forward, I have great concerns about what that will mean and how we will ultimately try to be responding to that issue.
And Mike, what are we seeing internationally?
Well, let me highlight several countries because we're going to be talking more about them in a moment when we talk about the variants. If you go to Europe, you have to immediately focus on two specific countries, the United Kingdom and Ireland. The UK is now a week into its third national lockdown, which is scheduled to last through sometime in mid-February. That's a date that Boris Johnson has set as a target for all 15 million of the UK's most vulnerable people to be vaccinated with at least one dose of vaccine. As of January 11th, more than 2.2 million UK residents had received at least one vaccine dose, but health officials are urging people not to grow complacent as the country deals with the continued surge in cases and hospitalizations, and despite what they call their Tier 4 most severe lockdown. Last week, hospitalizations increased by 22%. It reached a record high of 32,300 Brits currently in the hospital with COVID. Their 7-day average of new cases is right around 57,800, up from 52,500 last week. Their daily deaths this week are now at about 926, up from 610 last week, and a record high actually occurred on January 8th of 1,325. We're hopeful that the top of the curve may have been hit, as it looks like the numbers are starting to level off somewhat over the past several days. But the bottom line is they have been literally under attack by this virus. Anybody who's been following the news media, the pleas by the elected officials in England to please shelter in place has been a very real event. If we look at Ireland, it has experienced one of the fastest growing outbreaks in the world up to this point in January. The country's 14-day infection rate has risen tenfold in just the last 3 weeks to nearly 1,300 cases per 100,000 population. Very high number. Just to give you some perspective, on January 1st, they were at a daily reporting number of 1,753 cases, an overall 7-day average of about 1,347 cases. By January 8th, that 1,753 number had gone to 8,227 cases per day. The surge is at this point thought to be fueled by this new B.1.1.7 variant, alongside the opening of shops and restaurants and the relaxing of a ban on household visits for Christmas. Despite otherwise having a fair amount of lockdown activity, the cases are coming back in a major surge. The percentage of genomic surveillance samples looking for mutations in these viruses show that the B.1.1.7 variant, or the one from the United Kingdom, has grown each of the last 4 weeks, coinciding with the big increase in cases. On December 20th, it was about 9% of the isolates that were found in patients from Ireland. December 27th, that 9% went to 13%. On January 3rd, a week later, it went to 25%. And on January 10th, 45% of all the isolates or viruses obtained from cases in Ireland are this B117. So now, as a result of this surge, Ireland's entered back into a strict lockdown just before New Year's Day, which includes the closing of non-essential businesses, schools, limits on household gatherings, and they're expecting this to last right now through the end of January, when at that time it'll be reassessed by the government. If we look at other countries in Europe, we're seeing somewhat similar situations, although not as extreme as we've seen in Ireland, the United Kingdom. And the issue right now for all of these countries is what is happening with the variants that are present. If we look in Asia, we're seeing substantial increases there in Japan, where they have the highest spike of cases and deaths throughout this entire pandemic. And yet, if we look at other countries in Asia, such as Australia and New Zealand, they're still doing a remarkable job of keeping the case numbers down. We have seen in Africa a very major increase in cases, with the occurring primarily in South Africa, causing the president there to extend restrictions in that country through mid-February. I'm going to talk much more about that in a moment. For months, we had people writing into us telling us, well, Africa's doing something right. They're not seeing cases. And I kept responding back and saying, just wait, it will hit. I don't know why it takes so long. Right now, this past week, 18 countries in Africa are now reporting record high number of cases, and the numbers are growing quite rapidly. So, in short, the world is clearly under attack by this virus. We, unfortunately, are leading the way here again in the United States. And all I can say is that the vaccine is our light at the end of the tunnel, but we have to understand what that means in light of these variants, both in terms of the number of cases and as well as what it means in terms of how well the vaccines will work.